2, 1.
Good afternoon, and welcome to another week of Hello Health, where we talk to some of your favorite doctors about health and wellness. Now, my name is Grant Dodge, and I'm with Health Benefits Associates, where we help you with your Medicare and health insurance needs. I'll be your host for today. Health Benefits Associates has offices here in Reno, Sparks, and Carson City to assist you with your Medicare and insurance. So please make sure to reach out to us if you have any questions or need help. Now, this YouTube channel is not just for our Hello Health series that we have every week, but it's also our informational hub where we post important updates about health insurance topics in general, Medicare, or really anything that's going on with big changes to the healthcare world, which is always changing. We also have our upcoming Mastering Medicare series, which starts on September 15th, just in time for that Medicare annual enrollment period, where you...
Oh.
Yeah, I'm sure you are very busy, but first and foremost, I really appreciate you taking the time today to go over your sharing today, your topic, which is osteoarthritis, and taking the time out of your busy schedule to go over this topic with us. So, just as a reminder, we're going to go through your entire presentation, and then we're going to answer those questions at the end. So, Dr. Wood, without any further ado, go ahead and take it away.
Well, thanks, Grant. So I want to talk about osteoarthritis. There's some common misconceptions, and so I'll kind of start off with the basics. I do want to say, so a lot of people come in and they see me from my sports side, and they say, "Oh, I have arthritis," and I was like, "Oh, great." And then my next question is usually, "What kind of arthritis?" And they're like, "Well, I don't know. It just hurts." So osteoarthritis is a type of arthritis. Is basically wear and tear on the joint, and I'll kind of dive into that a little more. So first of all, what is a joint? I actually looked up to see what the official term for it was. Official definition is where two parts of the skeleton are fitted together. Um, so in kids, usually we have about 360 as their bones start merging. In most adults, we have 206. I guess that depends. If you get some fused together, then you'll have less. Um, but then after that, so we have 206. So that's a lot of places that we can get osteoarthritis in, or a lot of wear and tear. So what happens in the joint, and I actually have a picture of a knee behind me. We removed the kneecap, so you can't see it in there. But basically, what happens is we have this cartilage, and we think of it a cartilage kind of as a like a cushion essentially for the knee, or a cushion for the bone, and so you're not putting bone on bone. So you have it here. So then what happens is after the age of 30, we really stop producing this cartilage. Um, and so then what can happen is, people are rough on their knees or overweight, which is a large population in the United States. It's not necessarily healthy on your joints. And then that cartilage starts kind of wearing off and disappearing, and that can cause inflammation. So when the different things, the way that we can diagnose it is we get x-rays, which I'll get into in a second. But with inflammation, because it can be caused by usage. So like I said, when you go running or if you walk a lot, some of the most of the time your muscles will be able to take a lot of that blunt of the exercise. But when people are trying to get back in shape and they're like, "Oh, I started getting back in shape, and all of a sudden my knee really hurts," and it's because your body's not used to that, and so then that's rubbing off some of that cartilage, which is good. We want people to get back in shape. Please don't hear me saying that you shouldn't start walking or certain exercise. We want you to exercise. It's just start moderately going up. Don't go from the couch to a marathon. That'll probably hurt you in more ways than you know. But with the cartilage, there's different things that can hurt it. So inflammation is the main thing. Injury is the other thing. The way that you can hurt it is, if you played sports and you tore your meniscus, well, the meniscus is the cartilage, and that's one of the ways you can do it. And so when they go in and operate on it, they take out some of that cartilage. The other thing that can really affect it or cause inflammation is disease, and that gets into a whole different topic, which I'm not going to address today, but that's rheumatoid arthritis or autoimmune diseases. Um, so what are some of the symptoms of osteoarthritis? Well, it's kind of an ache or a pain in the pain in the knee. A lot of times described as like an ache inside it, and it can be tender when you push on certain areas of it. The other thing that a lot of people get is they get stiffness, um, and that's why, because we don't have the cartilage and you have the muscles, we should start stretching more, especially as we get older. I'm a little over 30 now and I'm already feeling the pain. So I really make sure I stretch when I try doing any kind of exercises because that will get the muscles ready and so it'll be less of a burden on the cartilage because the bones and the muscles will be able to strengthen, hold the structure together without pushing on the cartilage as much. Um, the way we diagnose the way we diagnose these the way we diagnose it is usually we get x-rays. And when you get an x-ray, most of the time they'll read it as degenerative joint disease. So what does that mean? A lot of people think they're the same thing. It's actually two separate things. Degenerative joint disease is what we see on the x-ray. And what we're looking for is just seeing if this space between your two joints is narrower or not. And that's basically what we're looking for. We can't see the cartilage on x-ray, but we can see the results of a cartilage or lack thereof, which is smaller spaces or smaller joint space. Um, other modalities we can test to do, we can check to see is with a CT that shows. So that's one of the things we need to kind of watch and check for. So exercising, but everything in moderation, as like the most beers have it on the bottle, is everything in moderation. I think that's a term we just need to apply across the board for most things in life. What you can do as far as treatment goes, so the first treatment is rest and ice for it if you have pain. And then if you have stiffness, use ice for pain, heat for stiffness. And then another saying one of my mentors would always say is motion is lotion. So make sure you're still moving. After that, we kind of get into some of the medical treatments as far as medications, things in the family of NSAIDs, which are like ibuprofen, naproxen. From there, we can bump up to steroids, which steroids are the best anti-inflammatory, and that's usually where you'll come in to see me by that point. Is we got to make sure you're getting physical therapy, so you're strengthening the structures around the joint to keep those areas strong, and then we try decreasing the inflammation. And we can do oral steroids. They're not great. They do okay, but they also cause immunosuppression in your body. And we're in the middle of a pandemic. So, it's kind of one of the things that we try using very conservatively. And the other thing we can do is we can inject steroid into the joint. I will say you can read somewhere, and most people are Google. I hope you look up and do research, and you'll find out that steroid is not necessarily good for cartilage, but it's a lot better than inflammation. And if the steroid takes off the inflammation, it's kind of one of those, one of the necessary evils that we need. And then there's other options also that you can do if you have a really bad degenerative joint that's worsened through osteoarthritis. We can try doing hyaluronic acid. Many people know it as a trade name, Synvis, Suparts, Hyaluron, and those can be injected, and they basically try lubricating the knee. We thought they'd stay in the knee. They don't really, but they do decrease the inflammation and help you get that mobility back that you need. And then lastly, if everything fails, then that's when we get you to an orthopedic surgeon and they go in and they put in a new joint. Um, but yeah, that's basically kind of the treatment and what is caused by osteoarthritis. So with that said, I'll hand it back to Grant.
Much for that presentation today, Dr. Wood. That I think was a lot of great information that you included in there. We do have a handful of questions here. How does someone know that they have osteoarthritis, or what are some of the major symptoms? I know you kind of went over them, but can you just reiterate those for us?
Sure. So the main thing, which brings almost everyone to the doctor, especially guys, a side note, interesting fact though, if you care to know, there was a study that they said that most married men live longer because their wives bring them to the doctor. Um, but one of the main things that gets people into the doctor is pain. And so if you have pain in a joint, a lot of times it can be a sharp pain but usually have like a dull, constant achy pain and then a sharp pain in between there. And that's usually most of the reason that people present with osteoarthritis to us. Other symptoms could be swelling and stiffness that they have in the joint.
Okay, perfect. Thank you.
Mhm.
Next question. Does everybody get some sort of level of osteoarthritis throughout their life, or is this something that someone can completely prevent from happening?
So a lot of times, as long as they can stay in shape and fit, they could prevent most of it because your muscles will take the brunt of it. There was one guy I think we were seeing, he was 90 some years old and all he wanted to do was keep skiing. And he had developed some osteoarthritis, but at 90, I think he was 97. I was like, you're doing great. Like, we're not going to touch anything. Like,
Wow.
we'll try treating it. So, I mean, yes, I think to a certain extent your joints are going to wear out, but yeah, you can. I guess the answer is yes. We all develop some form of osteoarthritis, whether it's symptomatic or not. No, I think the correct way to phrase that would probably be we will almost likely develop a form of degenerative joint disease, where that turns into osteoarthritis, which is the pain and inflammation. That kind of depends on a little bit of genetics and also a little bit of the just your body habitus and how well you treat yourself as far as exercise goes.
Got it. Got it. Well, hopefully, if I'm 97, I can still be skiing. That's pretty impressive. Holy cow.
Yeah, that's what he was. He was an interesting guy. He just wanted to go. We were like, all right, man. At 97, you go do you.
um, the next question is if I think if I have osteoarthritis, do I get an X-ray? Do I get a blood test? How is that? What's the best way to diagnose it? Go see you.
Yeah, come see a physician. It doesn't necessarily just have to be me. I deal with it a lot, being my specialty. But yeah, usually we do X-ray. There really isn't a blood test you can do. Like I said, we're talking specifically about osteoarthritis, not rheumatoid arthritis, but osteoarthritis. And yeah, it'd probably be imaging, so some form of X-ray is what we do.
Okay. And that's actually the next question is osteoarthritis the same as rheumatoid arthritis, which obviously it's not.
Yeah, no, they're two separate things. Rheumatoid arthritis has it's a different pathology. Your own body has some inflammation and it attacks itself. For osteoarthritis, yeah, you have inflammation, but it's more a single joint. Rheumatoid usually have multiple joints that are affected.
Okay. And next here, can osteoarthritis be cured?
Well, I think that's a long answer. The answer is yes with a joint replacement because you won't have that joint in there anymore.
Got it. Okay. Okay.
Yeah.
Now this next question here, I think this is one that I could probably handle. Is the next question was if I have AARP, can I come in and see you on that plan? Our office handles insurance, so I'd be happy to help explain whether or not an AARP insurance plan would cover Dr. Wood's office. But the last question I have here, what was that?
I saw a few patients with AARP earlier,
Okay.
so I'm guessing we cover it. I hope we do. If not, well, there we go.
Well, I can confirm whether or not they do as long as they just give us a call off air, of course.
Gotcha.
Last question. Will you be practicing at the new hospital?
No, I usually stay outpatient,
Okay.
so I won't be at the new hospital location. Right now, the office I'm at is the one at Vista and Sparks. I do work a little bit out of the one in Kitski, off Kitski. It's kind of tucked in behind like Nevada Urology area. But yeah, I'll be here.
Great. All right, Dr. Wood. Well, I think that's going to do it for today. Once again, I just really want to thank you for taking time out of your busy schedule to go over your presentation with us today and sit on our show. So really, thank you so much for participating today. We really hope to have you on sometime in the future.
Awesome. Well, thank you so much for the invite, Grant, and I really appreciate it.
All
Have a
right,
great
thanks,
day.
Dr. Wood. All right, bye-bye. All right, well, thank you, everybody, for tuning in today. Our next Hello Health event will be actually tomorrow at 10:30 with Dr. David Lamack and Alex Sampson. So make sure to tune in to tomorrow's stream with those two. Now, on the right-hand side of your screen, we also have the upcoming Hello Health and Mastering Medicare schedule. So please make sure to subscribe to our channel to make sure that you don't miss those important events. If you have any other questions about this topic, please put them in the comment section. We'll try to get to those answers. But thank you so much for watching today. My name is Grant Dodge with Health Benefits. Have a great day.